We're going to focus on how to diagnose a manic episode here according to the DSM-5 criteria. Regarding duration, the manic episode must be at least 7 days in duration or any duration if the patient requires hospitalization, and include an abnormally, persistently elevated, expansive, or irritable mood, along with an abnormally, persistently increased activity or energy for most of the day, nearly every day. The patient must also have a certain number of associated symptoms. Some of these include grandiosity, decreased need for sleep, pressured speech, flight of ideas, and distractibility. Decreased need for sleep means that a patient feels well rested despite sleeping much less than usual. Involvement in risky activities with painful consequences might include large business investments, gambling, or engagement in sexual activity with unknown partners. Some of these symptoms, such as pressured speech and flight of ideas, can be documented in the mental status examination, which will be discussed in a later video. As with most diagnoses in the DSM, the symptoms must be severe enough to cause impairment in social or occupational functioning or require hospitalization. In addition, the symptoms cannot be due to the physiological effects of a substance, medication, or other medical condition. There are also some specifiers that are important to include in your documentation because these will help guide your treatment approach. The current episode is severe if the patient needs almost continual supervision for the safety of themselves and others. On the other hand, the current episode is classified as mild if the patient has minimal symptoms but still meets criteria for a manic episode. The partial remission specifier can be used when a patient no longer meets full criteria for a manic or hypomanic episode for up to 2 months. And full remission is used when no significant signs or symptoms are present during the past 2 months. And here is an example of what your diagnosis may look like in your documentation in regard to bipolar 1 disorder. First, list bipolar 1 disorder and the current episode. That is manic if the patient currently meets criteria for mania. Then specify how severe the current episode is. That is mild, moderate, or severe. There are also other specifiers listed here that can be used, but are not discussed in detail in this video.